All right, good afternoon, everyone. This is How To Tuesday, all about TEFRA. We are going to spend the next 45 minutes just going over some of questions that we get related to TEFRA about eligibility, applications, hopefully answering some of your questions and providing you with a little bit more about where to get TEFRA information. So hi to everyone in the chat. Thank you so much for joining us today. I'm Megan Branham. I'm the Director of Community Health and Policy at Family Connection. For those of you that aren't familiar with Family Connection and our work, we are based in South Carolina. We are here to help support parents and caregivers of children with disabilities and special needs. We are parents ourselves who've navigated these systems personally and professionally, and all of our services are offered at no cost to parents. And part of our work includes providing trainings like today. We are going to go over a little bit about TEFRA Medicaid, the eligibility requirements, kind of hit the highlights of the application and review process. And then, like I mentioned, just discuss some of the frequently asked questions that we get related to applying in TEFRA. If you have questions or comments, again, please put them in the chat. We'll try to get to them as we go through, but hopefully today's presentation will provide you with enough information of just how to get started, or provide you with information of how to follow up with us if you would like additional support. So a quick overview, and I think it's important to start here because Medicaid can be pretty confusing. It's a pretty big system. There are lots of different Medicaid categories. Certainly the ones that you see listed here is not a full, complete listing, but these are the ones that are most known to families or just most familiar to those individuals that we work with. So in our state, in South Carolina, we have South Carolina Department of Health and Human Services. That's our Medicaid agency. It's also, you'll see it listed as Healthy Connections. Underneath those, you'll see listed different Medicaid programs, different Medicaid categories, depending on different eligibility criteria. So some of the ones you see listed include Partners for Healthy Children, Age Blind and Disabled, Family Planning, and Pregnant Women and Infants, and TEFRA, which is what we're going to talk about today. We do have other presentations that go into more detail about the other categories. So if you're interested in that, we'll provide you with details about our upcoming trainings if you want to learn a little bit more about those other Medicaid categories. But today is just going to focus on that box labeled TEFRA. We also think it's important to note that there is a federal component to Medicaid under Social Security Administration and SSI. Now, that is administered differently because it is at the federal level, but it's still Medicaid benefits that are provided in the state. So important just to note that, but again, for today, we're really going to focus on that TEFRA box and go into deeper dive on that. So to start with, what is TEFRA and who was Katie Beckett? Kind of the guide, really the guide and the reason for TEFRA. So Katie's story is that she was born with some really serious health issues. She spent a lot of time in the hospital, and through advocacy of her mom and parents, like her, really just trying to change the way healthcare is delivered for children who have special medical needs. And so, as part of the early '80s and changes to taxes and Medicaid rulings, the decision was made to allow for a special type of Medicaid for children like Katie to get those services and that care at home instead of being in a hospital. It was more cost efficient. It was just better for families for them to receive the care at home. And that's really how TEFRA began. And it has since then continued on, where South Carolina is one of 24 states who has a TEFRA option. So it's important to remember for TEFRA is that it is a category of eligibility. So it's an eligibility category in Medicaid coverage, just like any other eligibility category. So there are certain requirements that a family or a child has to meet, and we'll talk in detail a little bit about those. But the biggest ones are that the child is under the age of 19 and they meet the Social Security income childhood disability definition and institutional level of care. So again, the focus is on children who are of a certain age, who have a certain diagnosis, disability, and really it's more cost efficient for care to be provided in the home as opposed to some type of community or hospital setting. The other big difference for TEFRA than for other healthcare services or eligibility categories is that it's based solely on the child's income. It's not looking at the family's income or resources. It is based on the child themselves. So let's talk a little bit about what that eligibility looks like. And you can see here at a glance, that's what TEFRA is really looking at in terms of eligibility. So we mentioned before, there's the age requirements. The child does live at home and it's appropriate for the child to receive services at home. They do meet the definition of disability under Social Security. We'll talk about that in more detail. An important thing to remember is that the child is not currently receiving SSI. If a child is already receiving SSI, they are not eligible for TEFRA. So oftentimes families have to make a decision in deciding on, based on their needs and what would be most beneficial to the family, to apply for TEFRA or apply for SSI, or which one they really want to pursue. And we can talk a little bit about that too, but it's important to know that they cannot have both. They have to pick one or the other. Again, the child's income is the main consideration. It's not, parents' income and resources are not factored in. The current income listing is $2,742 a month. That is current as of earlier this year. Usually those numbers are updated annually. So their income must be at that limit, and then their resources must be at or below 2,000. And we'll talk a little bit about what is included in resources. And then that they meet a level of care that would qualify them to receive support or care in something like a nursing facility or a hospital or some type of intermediate care facility. So again, looking at the level of need that the child has for care that can be met at one of those type facilities. But again, it's really more cost efficient for the child to receive care in the home. Okay, so I think this is probably where people have a lot of questions about what's included in listing of impairments. So this is just a snapshot of those childhood listings. You'll see the link is at the bottom of the screen. You can also use the QR code if you want to go directly to the site itself. But you'll see they're kind of broken down into these categories, and certain diagnoses are included. For some families, they may have a child who has multiple diagnoses, or perhaps they only have one or two, but they are, it's pretty likely that another set of diagnosis will be coming. So the intent here is that really these impairments that are listed, the disorders listed, are things that are going to be with the child for an extended period of time. It's not a short-term illness that a family is dealing with. This is something longer term that's going to require very specialized care, is going to sort of determine other services that the child is going to need as they age. And so really the listing of impairments are going to be very detailed about what is included and what is not. There are things on there that are not listed that maybe you or I would think this should be. Why is it not? But as it currently stands, these are the ones that are included. And again, it's for the reason that these are going to be, pretty significant challenges and considerations down the road that are going to be with the child for years. I'm going to pause for a second and just glance at the chat. I see a couple of folks have put in some comments, and I want to see. Okay, great. All right, I think I'll be able to get to these in just a minute. So keep the questions coming. Some of these may be answered as we get into the FAQs, but just know that I've seen those, and we'll get to those in just a minute. So that's a little bit of the background, and I think it's important to know kind of how TEFRA began, what the intent is, what the eligibility is, so that right from the start, you kind of have an idea of whether or not TEFRA might be something that your child could be eligible for or that would benefit your child. So based on all of that, the first step in the process is downloading the application. So on our website, we have the full application packet that can be downloaded. Again, you can scan the QR code or click on the link to download it. We do assist families with completing the application. It is a lot of information to include, and so we will work with families page by page just to make sure that there aren't any questions or that everything's been completed so that the application can successfully be submitted and doesn't come back incomplete just because a section was accidentally missed. So we do take the time to work with families in completing it. There is only an English version of the application. Now we do work, our bilingual staff do work with families who are Spanish speaking to help translate the application and submit it, but just know when you go online, download it, there is only one version. It is the English version. And the packet that you're going to download from our website is the full and complete packet that you need to submit. So you can have it all right in front of you and just work through it page by page. So most people find it easy to, start with, once they download it, just kind of look at it, highlight the questions that they have, and then reach out to us. The next step in the process is working on completing and submitting it, like we said. So the next step is once, the information's entered, there's going to be supporting documentation and medical records that are needed to accompany the application. You'll see all of that detailed in the application. There are forms that need to be signed by the child's physician. We always encourage families to make a copy of the complete package before submitting it. That includes making a copy of all the medical records, any sort of other accompanying forms that may go with it, just so that when the packet is submitted either by mail, fax, or hand delivered, you still retain a copy. And so if at any point, a portion of the application gets lost in the shuffle or there are questions about it, you have that copy to refer back to. One thing that we often get asked and what we need to clarify is that while there are options to apply for Medicaid online, TEFRA does not have an online process. So the application does need to be completed and either mailed, faxed, or hand delivered to one of the HHS's office. So Medicaid does have to get a hard copy of it. There is no online process for submitting that. Once Medicaid receives the application, it's stamped with that date, and that's the date of the application. And that's important. You'll hear about later if there's an option to have services covered retroactively from that 90 days prior to submitting your application. All right, so you've gotten the form, you've completed it, you've submitted it. Now what happens? So while you're waiting and just kind of determine what's going to happen next, there are a couple of different steps that are happening. So Medicaid, HHS is looking at the financial determination. So they're looking at whether or not the child fits and meets those financial criteria. Again, their income's at that level, required level, their resources. So if all of that, is checks out, then the process moves on. And disability determination is next, where the rehab is reviewing those medical records. if needed, they are assigning, requesting additional documentation, maybe from a provider. There might be a VR specialist assigned to get more information, to talk to the family, talk to the provider. Again, request those medical records if needed. But all of that's happening just to make sure that the disability determination is there. So they're going back to that listing of impairments and seeing that the child who the family is applying for, that they meet one of those areas. And then the level of care determination process is happening. And again, they're looking here at where the child meets one of those levels of care. So you can see here listing, they're looking at based on the needs, are there needs that the child has that, again, could be, appropriately, provided in some type of care setting, like a hospital nursing facility. Not that they're in one of those, but that's the level of care that the child requires. And so that process is happening, after the financials are looked at, the disability, then looking at like where is that level of care at. And so they're looking at it until they determine that the child meets one of those levels of care. Now that process in whole can take, several months. It just kind of depends on how many applications are there, how detailed it is, if additional documentation is needed, that sort of thing. One of the things that families ask us is if they have questions, who can they contact while they're waiting? So the number that you see listed, families can contact the TEFRA office and ask about the status of their application. That number is 803-741-1165. Once we assist families, it does go to Medicaid and, invoke rehab in that review process. So once we've helped families with the submission, families really do have to contact Medicaid just to check on the status. Once the application has been reviewed and there is approval, then the family is notified, the child receives their Medicaid card and benefit information. Again, there is that retroactive period where families might be eligible to recoup or recover some of those costs that they've incurred 90 days before the date of the submission of their application. So again, we'll talk about that if that's something that your family is looking for or would like to consider. There's a section on the form about that as well. And in some cases, there are denials and there is an appeals process that can be requested through Medicaid. The important thing for families to remember is that there is a clock that starts ticking and that families do have that 30 days to request or submit their appeal once they get that denial letter. And families have the process and have the right to do that if they so choose. Again, sometimes denials just might be based off of information that's missing, or maybe a new diagnosis even. That may be something that, or maybe just clarity in what the diagnosis is. But again, that's a decision families can make, but they do have the right to appeal if that does happen. All right, so I'm going to pause here. I'm going to glance at our chat and touch on some of the FAQs that we often hear from families. Okay. All right, so a couple quick things I see. Yes, so if a family does have, maybe they have Medicaid, but maybe TEFRA is really what they need. They do need to submit that TEFRA application. And again, because all of that paperwork is going to be needed related to a diagnosis. So to go through the process of going ahead and submitting that application, it may just be, something that a family decides, the healthcare services that we have right now are just not providing what we need for our child. And again, maybe there's a new diagnosis. So all of that stuff will go in the TEFRA application. Again, for the most part, other Medicaid categories are specific to, a certain age or a certain individual or a certain income category. Again, because TEFRA is just based on the child, it's very unique in that. It's just based on the child. It's not looking at the family resources. So, going ahead and pursuing applying for TEFRA may be the best course of action for your family, just to make sure that, they're getting, your child's getting what they need. So let's see, TEFRA is Medicaid, so it's not going to take the place of Medicaid. It is, we'll talk about this, it is a secondary, there's secondary Medicaid or secondary insurance coverage. So a lot of families have TEFRA, and they may also retain their private insurance. So they do have both, and we'll talk a little bit about that. There is not a way for families to apply online. You can download the application online, you can submit it, but you do have to submit it by mail, a fax, or hand delivered. Okay, so yes, so we've got some good questions about, oops, let me go back for a second, questions about out of state, and we'll get to those in just a minute. Okay, good, some financial questions. Yeah, we are able to email out the application. Yeah, and a good perspective on the denial and appeal process. So yeah, just knowing that some families may not know that it's an option, or they may, not want to pursue it. But for some families, it may be the best course for them. It may end up getting approved in the end. So I'm going to go back here to FAQs. Keep the questions coming. They're great. So one question that we get is, so I've already applied for Social Security. Should I also apply for TEFRA? You can certainly still apply. The couple of things to consider. So for families, maybe they have moved from out of state where TEFRA wasn't an option. They may have decided to go ahead and apply for SSI and then move to South Carolina and say, well, now I know TEFRA is an option, so I would like to apply or at least pursue it. So families can certainly do that. Again, just the thinking about and consideration is that SSI is really going to be placed on, the emphasis is going to be placed on the parent's income, not the disability. So for families, if their income fluctuates, they may lose coverage, whereas, TEFRA eligibility is going to be based on the child's income and disability. Again, it's two separate processes of applying. One may take longer than the other, and you're going to get two different, outcomes at the end. For some families, they may really want to pursue Social Security benefits because, there's some financial support there. For others, TEFRA is really the best option because they really need, those medical services covered. So something that we can talk through with families just in helping make that decision. So for a lot of our families, they have a child who spent time in the NICU, and TEFRA is, a great, maybe a great option for them. Again, for all families that apply, they will, the child cannot currently be hospitalized, but once they are discharged, once they leave, they can, certainly begin the process of applying. Okay, so TEFRA is not something that's really, maybe the name may not be well known outside of us, those of us who work in this space or that you're familiar with as a family. So, there may be a provider or a pharmacy say they don't know what TEFRA is or it's not coverage. Well, TEFRA is just Medicaid. So the Medicaid card that's issued will say Healthy Connection Medicaid, not TEFRA. And then if there's any questions about coverage, there's certainly member services, 800 number that can help resolve those issues. But just know if, if you say TEFRA or someone doesn't know what it is, it may just be because they're not familiar with the name, but it just is simply a Medicaid category, Medicaid program. Okay, so sometimes families will submit the application, but they maybe get another form or something else in the mail. oftentimes what's happened is that there is, through the review process, there may be additional information that's needed. So there may be an additional form that's requested, or additional, again, copies of medical records, or just information in determining level of care. So the best thing to do is just follow those instructions and submit it. And again, if there are questions about the status of your application, or kind of the where it's at in the process, or just any other general questions about TEFRA, once you submitted it, you can contact the TEFRA office in the 803 number. Okay, so within the application, there are questions that families will often just not, maybe not sure how to answer it, or not really sure what's being asked. And so we pulled out a couple of those just as examples to kind of help provide some additional details. So there's one question that asks about helping to pay for the child's medical bills from the last 3 months. Again, that's that retroactive period that we talked about earlier. So if you say yes, you are interested in it, then there is consideration for those medical services covered for up to 90 days retroactively from when you applied. So that's something that if you are interested and do want to pursue that option, that you can select that in the application. Another question about the child is do they have a disabling mental, physical, emotional condition that causes limitations? So yes, that's that we want to make sure that families are saying yes, that's the reason that we are applying. So sometimes maybe families are confused, like, do we have to have all of those, or we don't really know what that means. But just making it clear that yes, there is a health condition that is causing some limitations, or is along, as the child's had for several years, does need special support. Just making sure that that's clear in the application, so that it is seen the child is in the review process, they are reviewing them to be considered for TEFRA. Income, that's often a very big question. And income sources, there's a table listed where families can put those income categories, and making sure that they are within that monthly limit of that $2,742. Two things that are considered and are included in the monthly income is child support and/or any type of survivor benefit. So anything that the child is getting, has access to right now, that is being given for the intent of care for the child, would be considered towards that child's income. For most families, when they're applying, the child's very young, they don't have any income, they maybe don't even work a part-time job. It may be different for older youth who families are applying for, but for most families, there is not going to be any income that the child is receiving. So there's not going to be anything listed there. Now, resources is where a lot of families do have questions, though, because what counts and what doesn't. One of the more common questions is, what about a retirement account or a college savings account? Those are, they can be listed as other, in those other categories, but they're not going to count towards those child's resources, because the child's not going to have access to them until after they've aged out of TEFRA. So the child's not going to be able to utilize those. It's not something that the family can get access to quickly and utilize. It's something that's a savings plan or account that the child's, again, not going to be able to access or utilize until after they've already aged out of TEFRA. So it's not really, doesn't count in that regard. And then again, does a child have private health insurance? And yes, a lot of families do have private insurance or some other type of insurance, and that Medicaid, TEFRA Medicaid, is considered secondary coverage. So they're going to look at that first primary coverage option, and then where Medicaid and TEFRA can pick up those other healthcare costs that maybe are not covered under a family's primary insurance. So again, those are examples for, let me go back for a second. Those are examples on the financial piece. There may be others where, you know, a family's not sure whether or not it counts. I'll say, and I think I saw this in the chat, one of the other questions that we'll get is like an ABLE savings program. That may be a great option for families who want to, you know, have some money, or maybe have money given by grandparents or things like that, that they want to, it is for the child, but they want to make sure it's protected and doesn't count against them in the income or resource category in this process. So ABLE savings accounts are great options for families if that's something that they want to consider. Just making sure that, you know, they're, you know, setting that up, and that's that money's still there for that child. And again, it can be part of making sure that as they're reporting all of their resources, income, it's all listed there, but just making sure that, you know, the financial piece isn't a limitation, or isn't, you know, a factor in the child not getting services or not being eligible for services. So lots of different scenarios that we can certainly talk through individually with you, but just knowing that, you know, making sure that all of those are listed and in the right category is going to be very important when completing the application, so that they can determine whether or not the financial eligibility is met. All right, so a couple more real quick is, what about the in-home care certification, and who has to sign that? So that does have to be signed by the child's medical doctor, their provider, and not, you know, maybe their primary, maybe even they're seen sometimes by another medical provider, but in this case, it does need to be by the child's physician. And the doctors that we work with are oftentimes very familiar with the TEFRA process, and are familiar with completing the form, and should be able to do that relatively easily in order for you to submit that. So we are coming to the end of the presentation and the end of our time. I am going to glance at the chat real quick and just see if there's any other questions that I can go ahead and answer right now. But I do want to make sure that before we close out our time together, that you know how to reach us if you have questions. And I mentioned that there are a lot of families that we work well with who have, you know, have questions about applying, or just have other questions, not just TEFRA related, maybe healthcare, or maybe even education. But in this case, our healthcare team is here to answer questions about TEFRA, about applying. So you can contact us. Our 1-800 number is listed. It's 1-800-578-8750. We do have our Spanish line. We are here Monday through Friday, 8:30 to 5, and our team will answer questions if there's something that they can't answer, or if there's maybe they need to refer you to a member of our team. They'll get your information and hand you off to a member of our team to help get those questions answered for you and provide you with that information. So, and if there's things that we didn't cover today, or you now have more questions from the presentation, the best way to get those answered would be reaching out to us through that 1-800 number. And we are happy to sit down and walk through the application with you, or just answer any other questions that you may have. So I am going to just glance at the chat real quick and see if there was anything else that stood out. So there's questions about network and providers. So all of that information is going to be, it's going to be provided to you when the determination is made, and it's going to be those Medicaid eligible providers. So, you know, oftentimes there may be other, you know, providers or services where you want to change, you know, maybe change a provider, or look at another service option, but you're going to get a listing. It's just basically any provider that is providing Medicaid eligible services, and is and that's, you know, a lot of them in our state. Yes, the PowerPoint is available. So there is a question about case management. So there is case management available. It may look different. It's not necessarily through TEFRA, but there may be case management services that might benefit a family through Department of Disabilities and Special Needs, through maybe one of the other providers. A lot of times early intervention is helping to case manage. It just kind of depends on the family, the child, what sort of services they're looking with. We often help families navigate services and benefits too. So you can certainly contact us just to kind of help make sure that, you're aware of and are exploring all options. Okay, child can receive TEFRA through up till their 19th birthday. So they're, 18. Once they turn 19, then they are no longer eligible for TEFRA. For a lot of families, they may want to transition to another Medicaid category like age blind and disabled. That's often the case. But again, that's something to think about for families who maybe have children that are 14, 15, 16, looking at a long-term, once TEFRA is, they're no longer, the child's no longer eligible for them, what's going to be the next best coverage for them. Let's see. So there was a question about the income and resource. So yes, so the income is monthly, and then their resource total is that 2,000. So there's that 2,742. That's that monthly income, and then looking at the child's total resources. Thanks to Marie for listing our trainings. Yes, there's a question about genetic disorders. There is a listing in there with the in that childhood listing of impairments. Just genetic disorders are included in there. There are others that are in there as well. And so again, just to kind of be aware of what's out there. And then, again, in a lot of cases, like I mentioned, a lot of the providers, the doctors that we work with and work with our families know that, that a child might be eligible for based on their particular diagnosis. So again, that's just one of the pieces that they look at for the eligibility, but there is it's a pretty comprehensive listing of all of those impairments and disorders, that how they have it categorized. And again, most of the time, families or a child's going to be eligible, because the diagnosis or the healthcare needs that they have are, pretty significant and long lasting. I think that those are pretty much, I think I've gotten through most of the main questions. Again, just to recap before we finish up our time together, we do have upcoming trainings that are provided virtually, in person, a lot of different topics. We are working on a couple for later this fall related to SSI, Social Security income and eligibility. As many of you all know and have heard, families who are currently receiving Medicaid, there is an annual renewal redetermination process that has resumed a couple months ago. So helping families understand that, know that that's coming up, the process for that. So that may be something that you and your family may be interested in attending, but we've got a long list that's available. Our training calendar is updated frequently. If you don't see something that you're interested in or are curious about, you can always contact us with that 1-800 number I mentioned, or look on our website just to see what other updates that we have. So I know we are right at time, and I want to thank y'all so much for attending today's training. I really hope that it was helpful. I know it was a lot of information in a really short period of time, but again, you've got our 1-800 number. You know how to find us. Just an ask again to please complete the survey that should pop up after the training ends. and that you will get a copy of the PowerPoint presentation. And again, we hope to hear from you. If you have any other questions, if there are any other support services that Family Connection can provide. So thank y'all so much for your time. Appreciate the kind words, and hope everyone has a great day, and hope to see you on one of our upcoming trainings. Thank you. Bye-bye.